Let everybody get settled. All right, good morning. Thank you guys so much for joining us today for this community conversation. We're very excited to have you here. Metro United Way's overarching goal is really to ensure that every child enters kindergarten ready to thrive. We know programming alone can't change the trajectory of a child, so we really have to come together as a community to ensure we're working towards the same goal, understand the work that each of us is doing, and support each other's work. Now is the time to really become united. Understanding the services that are available in our community is critical to helping our children reach their best potential. So much has changed over the last 2 years that we really felt like at Metro United Way that it would be helpful for the community to hear from some of our community experts on the services that they provide. Today, we'll be hearing from Darcy Taggart with 7 Counties, Melissa Phillips from First Steps, and Holly Moore from JCPS. Each one will provide information on the services that they provide for children birth to age 5, who is eligible for service, and how to make a referral. All participants are in listen-only mode, and this is being recorded for later viewing. So please feel free to post your questions in the chat, and we'll send a link of the recording later for anybody who has to hop off early. We'll answer as many questions as possible at the end of the presentations. For the questions we don't get to, I will send a follow-up email to all the registered individuals along with the materials and slides that are presented with the answers to the questions as best as I can. I'd like to now introduce our first panelist, Melissa Phillips. Melissa joined us today from KIPTA's Kentucky Early Intervention System, also known as First Steps. Her passion has always been working with families and children. Her 20+ career has been doing just that in one capacity or another. She has a bachelor's degree from Eastern Kentucky University. This degree led her to her first professional job as a therapeutic recreational specialist at Our Lady of Peace, formerly Carditas. I'm hoping I'm pronouncing that right. She spent 5.5 years at the facility working with developmental delayed teenagers and with mental health issues. This experience really shaped her as a person and really shaped her career. She's obtained her master's degree from Spalding University in social work while working full-time. After receiving her master's, she spent 17 years at the Department of Community-Based Services, DCPS, where she specialized in adoption for a majority of those 17 years. Prior to leaving DCPS, she served as the Service Region Clinical Associate, SRCA, for the Foster Care and Adopted Unit and for ongoing services. In 2017, she transitioned to the Office of Children with Special Healthcare Needs to manage the KIPTA Kentucky Early Intervention System, also known as First Steps. So Melissa, the floor is yours.
All right. Good morning, everyone. I hope everyone's doing good. I will try to share my screen. Okay. Here we go. So I have a short presentation, and then we have some resources, some frequently asked questions that Kimberly is going to be able to give to everyone. But I am with the Kentucky Early Intervention System, formerly known as First Steps. We're still in transition. Everyone on this call still knows us as First Steps. But I did want to introduce that there is a name change, Kentucky Early Intervention System. The acronym for that will be KEYS, K-E-I-S. We still use both terminologies, but if you hear the Kentucky Early Intervention System or KEYS, that is synonymous with First Steps. We serve Jefferson County, Bullitt County, Spencer County, Shelby County, Oldham, Trimble, and Henry counties. So there are 15 points of entry throughout the state. And our point of entry is considered KIPTA district, which covers those 7 counties. So here we go. So what is Kentucky Early Intervention System? We serve 0 to 3-year-olds with significant developmental delays or an established risk. We function under the educational model, which is a coaching approach versus a medical model. So instead of a clinic type setting or an hour of therapy per week or whatever is deemed necessary in the medical field, the educational coaching model, we go into the natural environment and we coach the parent on how to interact with the child and do the different interventions with the child so that they can do those daily during daily routines. Services are provided in the child's natural environment, like I said, and it's a family-driven program. Referrals for services from physicians do not guarantee a child receives services. A court order does not guarantee a child receives services. So it is all parent focused. Once we receive a referral, we contact the parent, ask them if they're aware the referral was made, if they have concerns for their child, and if they would like to proceed with the program. The services that we're able to provide, all eligible children have the right to receive the following services at no cost to the family. That's the screenings, the developmental screeners, the evaluation, service coordination, IFSP development, which is their plan of services, implementation of parent rights. And then eligible children, let's see if I can, here we go, I need to move this. Eligible children can also receive the following services. So that the therapeutic interventions that we provide are physical therapy, occupational therapy, speech therapy, developmental intervention, assistive technology, audiology services, vision services, nutrition, psychological, and social work. So anyone can make a referral. Some people in the community think that they have to have a physician call in a referral for them or fax a referral, but anyone can make a referral, including, the daycare can make a referral, a family member can make a referral. Anyone can make a referral, and it is the exact process I just detailed a minute ago. We will contact the parent once a referral is made and see if they are interested in moving forward with the program. We take referrals via the phone, fax, or referral portal, which is available to physicians. Communication with the referral source. So this is a big point. We are not able to communicate with the referral source, whether it's the physician, whether it's the courts, whether it's whomever it is. We cannot communicate with the referral source until the parent consents to that. So once a referral is made and we contact the family, if they're not interested in services, or if they say, yes, we're interested, but then they don't follow up with submitting paperwork, then their file is closed prior to our ability to get a consent to talk to the referral source. Once the family does consent, then we can talk to the referral source. What is the referral process? There is a resource paper that Kimberly will give you regarding the referral process. In the initial steps, referral received and parent or guardian is contacted within 3 business days. Some of this has changed due to due to the past couple of years with COVID, we actually in KIPTA have been able to implement some technologies to help us that we didn't have previously. So now we are able to use DocuSign, and we do use some teleintervention. But the goal is still to contact the family within 3 days. The parent is contacted, we explain the program, and we either have them come in person for that initial, we mail them paperwork, or we do the DocuSign paperwork. And this is the screenings and the consents. After that paperwork is received and processed, there's an intake and evaluation. At the point of the screenings and the family still has concerns, so some kiddos will pass the screenings, the parent still has the right for an evaluation, or they may choose at that point in time, if their child passes screenings, that they no longer want to move forward at that time. But those children that do move forward get an evaluation, and then that determines their eligibility for the program. The evaluation does. After that, we do a family assessment, a routines-based assessment, which is the service coordinator getting to know the family and what their needs are, what their daily schedule is, what the issues are, what they need from the program as far as the interventions with their child. What daily routines do they need their child to have assistance with? And then we develop the plan. We do have a 45-day timeline from the time of the referral till we're supposed to have a plan in place. That is the goal, and we strive to meet that. There are reasons that there could be delays. If there are parent delays, sometimes there's delays in obtaining medical records, which is part of the intake process. We have to obtain a recent well child check. And then sometimes kiddos need an audiology exam. So there's just different things that can delay the 45-day timeline, but that is the goal that we strive for all kiddos. What happens once services begin? Children are eligible for 1 year at a time. Eligibility is redetermined annually on via a new evaluation, review of medical records, and parent or team concerns. So not one of those things determines continued eligibility. It's a combination of those things. Services are provided as outlined in the IFSP, the plan. Service coordinators meet with the family and IFSP team every 6 months to update the outcomes identified on the IFSP. So they do meet at the 6-month mark to make sure everything's going well, to see if anything needs to be tweaked or changed. Assistance with transition from first steps is provided to all families between the age of 2 years and 3 months to 2 years and 9 months of age. We do receive some referrals where the kid is almost 3 years old, and we take those referrals up to 45 days before their 3rd birthday. If it's past that 45 days, we cannot take the referral because we can't get an IFSP in place in that time period. But we do take them up to 45 days before their 3rd birthday, which makes that transition considered a late transition as they're moving into the public school system, if they choose to move into the public school system. So how can you assist with the referrals that you are making? How can you assist us with meeting these kiddos' needs? For a medical provider, you can send a copy of the most recent well child check with the referral. That is extremely beneficial. And if you conduct an OAE screening in your office, if that child passes, those results would be great as well. Because then we don't have to move forward with having the family in for an OAE screening and or sending for a full audiology exam. If they fail the OAE screening in your office, that is perfectly fine too. That's good for us to know as well, because we wouldn't redo the OAE screening. We would probably go ahead and refer the kiddo for an audiology exam. For childcare providers or teachers, if an ASQ, ages and stages screener is completed, send with a referral if it's within 30 days of completion. And if you just send it along, that's great. Sometimes we hit that 30-day mark while we're processing the referral, so we do new ones anyway, but it's always helpful to have more information than less. For ongoing services for childcare staff and teachers, allow providers into the classroom for sessions. So our providers, like I mentioned before, do provide in the natural environment. That includes the child's home, their daycare center. We are there doing their day-to-day living is where we try to provide their services. And again, I did also mention that we do use teleintervention some currently. So that is also a possibility. But yes, allow our teachers in the classroom. We need them. Did I say teachers? I meant providers. Allow our providers in the classroom and let them do their services among the day-to-day, whatever's going on in your classroom. So it's beneficial to the program and to the child if they can help the child in the setting with the other kids. They should not take a kid out to a private room to do their session. Be open to utilizing strategies suggested by the providers. Assist with communication between your center and the provider and the family. So sometimes providers will either talk to the caregiver and the caregiver relays that to family. A lot of providers will have a notepad that they will leave in the child's bag or in the cubby so the parent can get that information upon picking the child up. Medical providers encourage families to consent for First Step staff to communicate with your office. Send medical records as soon as possible once requested. And update our office and changes in contact information when applicable. For all, share with families our educational approach to services. Ensure families do not anticipate free services. This is not automatic, as there's a process to determining a family's ability to pay. So those on a prior slide, I did list what services are free for all families. And then the intervention services is when we determine ability to pay. That doesn't mean they won't get free services. It's just not a guarantee. That is First Steps in a nutshell. This is my contact information. There were some questions that Kimberly forwarded, and I can try to find those. Do you remember any of those questions?
We can actually go through those at the end.
Okay. Well, that is Kentucky Early Intervention System, First Steps in a nutshell. Kim, you're on mute.
You'd think after 2.5 years, I'd learn to unmute. Thank you very much, Melissa, for the great information. Your services that you provide are just fantastic. You know, I have a son who went through First Steps, and you know, the only reason he's doing what he's doing and how well he's doing is because of the early intervention he received from both JCPS and from First Steps. So we thank you for all you do. Next up will be Miss Holly Moore. And Holly Moore is joining us from JCPS, and she's been with JCPS about 16 years. She's currently a special services ACE resource teacher. She previously taught early childhood in JCPS, and she is the mother of a JCPS graduate and two children in JCPS high schools, as well as one energetic pup. So Holly, the floor is yours.
All right, thank you very much. I'm gonna just get my screen shared.
Holly, you are muted.
And second, as we work through technical difficulties, thanks for bearing with me.
Able to hear me now? No,
You're good to go.
you can hear me?
Yes.
Okay, all right. Are you able to see the PowerPoint?
Yes, ma'am.
Okay, wonderful. All right, so let me back up. The programs that JCPS offers for preschool age students are those that are 4 years old on or before August 1st and qualify based on household income and or special needs. And then we also have children who turn 3 years old on or before August 1st and have an individualized educational program. That's also referred to as an IEP. So just as First Steps was sharing, the children who are in the early intervention program, if the families choose to come through to the public school system, they can then have a meeting to help determine an assessment for their child to see if they will still be eligible within the public school system if they are through. So just some program quick facts. Free to all eligible families. We prepare students in the areas of general knowledge and mathematics, language and literacy, health and physical development, social, emotional, and self-help development. Our program uses a comprehensive curriculum for the academics. So students who may move within the school year will not miss any learning. All the classrooms are on the same time frame for lesson delivery, but it may vary based on student needs in the classroom. We are full day, 5 days a week, Monday through Friday, with an instructional day beginning at 9:45 a.m. through 4:35 p.m. Our students receive breakfast, lunch, and a snack in the afternoons. We do have a universal rest time where students are able to rest their bodies. Some students do nap, If your student is not a napper, that is okay. Teachers have what we call like quiet activities, things that children can do during this time to let other children also rest. Transportation is available. We also have early childhood centers, such as George Unseld is one, Duval, Dawson Orman. So we do have early childhood centers where it is just early childhood students in the building, but we are also located in school buildings as well, where there may be 1 to 3 classrooms in that school building. So transportation can get your student to school, or you can also parent transport if you would like. So application information. For application information, please visit the JCPS website and it's at www.jefferson.kyschools.us, or you can contact the Early Childhood Application Center at 502-485-7677. There are some additional required documents for when you're applying. A picture ID is required for the parent or legal guardian of the child. Any custodial paperwork that you may have is also, if that's applicable, you can also supply that. Family income verification, so the previous year's tax return or household W-2s, unemployment benefit statement, SSI, any other documentation of financial support, child support for all children. So those are some of the income verifications. We also will need the child's proof of birth. So that official state certified birth certificate, not the cute one that they give you at the hospital, but the one that is mailed to you. Let's see. And then proof of residency. That can be in the form of a water bill, LG&E bill. It just needs to be in your name coming to the address. And then health documents required. So a current immunization is required for children to begin attending the preschool program. And then a current physical is also needed on file within the first 60 days of your child enrolling in the program. We also do, through our JCPS Early Childhood Program, we will also do a vision and a hearing screening within 30 days of your child also enrolling in the program. So child find screenings. JCPS conducts screenings open to the public throughout the school year at least once monthly. These happen all throughout the district at different locations. So that is how those are set up. It's not one centralized location. They happen across the district throughout. The Brigance Early Childhood Screens 3 are the district approved screeners that are utilized. However, additional state approved screening tools are utilized as appropriate based on the child. If you feel your child may benefit from a screening to determine next steps, then you can please visit the referral for multidisciplinary evaluations that's linked right here. And I'm going to see if I can click on this and show you what it looks like. Can someone let me know, did that screen change for you all?
It did not.
Okay, hold on. So it's probably not going to let me switch to it. When you click it, it'll take you to it's a Google Doc. It will ask you certain questions about your child, your email, the student's full name, the address, whom they live with, the student's grade level, and then just some other questions regarding to the concerns that you're having. People who can make a referral are those that are vested in the child's best interests. Sometimes parents will share with us when they call to set up that evaluation or make that referral request. They may say that their child's physician had told them that, maybe they might want to get their speech and language looked at. So generally families will generate that referral, but it could be off of maybe a pediatrician or another service provider recommended to the family to come and see about some further screenings to determine any needs that the student may have. Our school readiness program, so students are actively being prepared for kindergarten through intentional, fun learning experiences provided in a developmentally appropriate learning environment. We focus on the whole child learning. So like I stated earlier, we have a comprehensive curriculum, and what that means is that addresses all of those areas, the literacy, the math, everything is built into the curriculum, as well as we have a social emotional learning curriculum that we also use just to address those social emotional needs of children. And again, those are used throughout the district by each classroom. So if a student does have to move mid-year or attend a different school, they're not going to have a lapse in anything that has been delivered. Summer options are open to preschool students. Camp Ready for K is one of those options that helps prepare students for kindergarten in the fall. We generally get information about the camps and their locations in the spring. So that is information that is given out with the locations that will be utilized for that summer. Also, this past summer and the summer before, we had a Camp Jumpstart. This was for 3-year-olds that are in our program and 3-year-olds in general. And it focuses on that social emotional learning, and just really gives them a chance to just have that school setting and get used to buildings and those types of things. And then these readiness checklists are in English, and there's a Spanish version that I've hyperlinked. This has skills that students will need to be successful in kindergarten, but also these are skills that they're going to be gaining throughout their kindergarten experience. So it's great to have some of these skills worked on, but they're not necessary to move into kindergarten. The only requirement is that the student is 5 years old on or before August 1st. And that's really the only kindergarten requirement. But these checklists are really nice. It's got great little things that you can do with your child to help promote that learning at home, as well as making that school home connection. Our children also, within the program, the teachers will complete 2 home visits, and there's 2 conference opportunities. Home visits right now and conferences have been being held virtually with the pandemic, but in the past, before pre-COVID, we did get to come to the households and meet the family in your home, and just kind of get to know you and build that relationship. So that is something that still will happen with the teachers once your child is enrolled in the program. Just thank you very much for allowing me to speak. And I will put some of those hyperlinks. Kim, would you like me to put the hyperlinks to those things in the chat?
That would be great if you could do that. I did go ahead and put in the EC registration PDF and the school visual as well. So those are in the link for anyone who wants to access them. If you can't access the chat right now, I will send those and attach those to the email follow-up that I send out later in the week. So now we have Miss Darcy Taggart. And Darcy is an early childhood mental health specialist and clinical supervisor at 7 Counties Services. She's been working in the field of mental health for 20 years, with most of that time spent specializing in early childhood services. She's a licensed art therapist and a licensed clinical counselor, as well as a registered play therapist. She is passionate about coordination and consultation in early childhood and supporting children and families. Darcy, it is all yours.
Thank you. I'm gonna share my
And
PowerPoint.
Holly, if you could stop the share.
If I can find it. Oh, there it goes. I bet I can do it now. All right. Just out of curiosity, is it actually on? Somebody raise their hand and tell me, really just Kimberly, you raise your hand and tell me if it's on, because you're the one I can see.
You're good.
Okay, good. Thanks. Good afternoon. Glad to be here. Glad that you all could be here today. I am going to share some about early childhood mental health services, specifically at 7 counties. When I was asked to do this, I said, please don't ask me to share about all of the services 7 counties provides, because that list would go on and on and on, and it would be hard for me to do that. But early childhood services, I feel like I have a pretty good handle on. And so I'm happy to share about those and talk about those a little bit. When I think about early childhood services at 7 counties, we really have sort of two pots of services that things come from. We have our clinical services that are sort of broader than specifically just what I do. And then we have the grant related services. So I'm going to talk about clinical services first, and then a little bit about the early childhood mental health grant as well. For clinical services for 7 counties, we have individual and family therapy services and case management services. So those services might be across the board, providing case management, consultation to families with case management can take the form of Kentucky Impact, which does wraparound services, providing supports in schools or case coordination with OT, speech, other types of services that aren't necessarily just in-house to 7 counties. Also, case management can do resources and referrals for families if they need community-based resources, concrete supports that they might need. We have a school-based services division that serves kids. And when I say early childhood mental health services, I'm really looking at kind of services for kids 6 and under. So school-based services, we do have some school-based folks in various schools throughout the district that provide those services. Acute crisis services are located at the 914 East Broadway office. And so those services for families in crisis, they are more emergency-based services, sometimes short-term services to try to get kids out of crisis. Oftentimes, once the family is out of those crisis services, they will send them on to one of our outpatient sites to do individual and family therapy. We also have in-home and community-based support services. There's 3 different teams that do in-home and community-based services, therapeutic support services, CCC, which is the Community Collaboration for Children. They have both some grant services and some Medicaid-based services. And then also our family, our FRP program, Family Recovery Program. So all of those are in-home and community-based. Some of those are more intensive. Some of those are less intensive. More intensive services might be 2 to 3 times a week for a period of about 3 months. Less intensive might be 2 or 3 hours a week, but for a period of 6 to 9 months, depending on kind of what the family needs and if they need more intensive or less intensive. And then we have our traditional outpatient services. So we've got 3 different child and family offices that are in Jefferson County, one in the West End, 22nd and Broadway, one in the south part of the county down on Stone Street, and then the one at 914 East Broadway. That's also where the outpatient site at 914 East Broadway is also where our transitions program is housed, which is specifically for individuals and families open with the Child Protective Services system. And then we have an individual or an outpatient site and some community-based services out in each of the 6 counties. When they were talking about the keys or the first step services, I was like, oh, those are the same 7 counties, right, that we serve. So Jefferson, Henry, Trimble, Spencer, Shelby, Oldham, and Bullitt. And those are sort of where those are. There is a division now of 7 counties that's down in Bowling Green that also serves families down there as well. But I know mostly the clinical services that are here in Jefferson County and the 6 surrounding rural counties. So those are our clinical services, and we'll talk in a minute about sort of how to get involved in some of those. Then we have some grant related services. The early childhood mental health program, and this gets confused all the time. We get referrals for clinical services to the early childhood mental health program, which is the grant that I co-administer myself and another lady down here named Lee Garrett, who helps with those grant related services. And those services really, that program really provides for non-billable services. So not clinical services, which are something that we do across all of those sites, And I said recently that if Lee and I tried to do all of the clinical services for kids under the age of 6 that we serve in this region, we would be nuts and nobody would get served the way that they need to. So I feel like at last count, that was, I mean, somewhere around 600 to 700 families of kids under the age of 6 that are being served within our region. So, so we couldn't do all of those clinical services, but we do provide consultation. So sometimes that looks like consultation at our various sites with other clinicians serving those families to try to build capacity for our clinical staff to see those families in clinical services. But that might also be consultation with childcare centers or consultation with families directly on, I'm looking for a resource, I'm looking for a service provision, or I'm looking for some understanding of kind of where I might go to find this thing that I'm looking for. So we do consultation that way. We do observations in childcare centers and preschool classrooms for kids that are struggling and need some support services, that maybe need some feedback to the teacher or to the classroom setting in general to say what can maybe they do differently to support that child in the classroom. The original, I don't even know the word I'm looking for, but the original reason that they started the grant, probably 25-ish years ago, was to prevent, or to at least attempt to prevent, expulsions from childcare centers. And so originally that early childhood grant was designed to support childcare professionals, and we've sort of expanded that somewhat to some of our preschools and things around town, but to prevent expulsions in the preschool population, or to at least identify ways that we can support those professionals serving children in childcare and preschool classrooms. And we do training and consultation as well with, same thing, with childcare professionals and folks around town. I also have done trainings. I've gone to parent groups that a childcare has done, or sent a webinar of myself talking. Sometimes it's not me specifically. It might be easier to send a sort of a pre recorded version of that, but definitely some training, some consultation, those things are there. The early childhood mental health program came out of the Kids Now funding that came out of the big tobacco settlement many years within the state. And that provides for one, sometimes two, as we have in our region, early childhood mental health specialist. In each region, there's 15 regions across the state of Kentucky. So in each region across the state, there is at least one early childhood mental health specialist. And there's also now one early childhood consultant. So that came out of a little bit of a separate pot of funding, but those are also grant related services. And that funding came out of the core grant, the early childhood consultant funding, to provide there to be a consultant who does the same kinds of things: consultation, observation, trainings, but more specifically related to children and families who have been affected by substance exposure in some way, whether it's prenatal exposure, whether it's current things. So we do some of that information with our drug court. Our ECC used to work pretty heavily with some of those families as well. Periodically, we have additional offerings of things, groups and or other things going on within the community. And then we each sit on some community collaboration meetings to do consultation in our region with that. So that is a wide range of mental health services. Currently in our region, we have myself and Lee, who are doing the early childhood mental health thing, the early childhood mental health specialist program. We are currently still seeking an early childhood consultant to replace our lovely consultant who left us in May to go be a grandma, and which I love that she moved to be a grandma, and we hated to lose her. Her name was Risa Sandora, but we are still looking to fill that early childhood consultant position. So that person is a part-time clinical, part-time grant related service that that would fill those consultant positions with our families dealing with substance abuse. Prior to this training, Kimberly had sent me a few questions, and so I attempted to answer all 4 of those questions specifically. I realized there may be more that come up. One of those was, what resources and trainings related to infant and toddler mental health do we make available to families? So periodically there are Groups that are offered around. Sometimes some past examples include a nurturing parenting group that was being offered here at 7 counties, a Connect the Dots for ASD group for parents with children who were on the autism spectrum. We've done some incredible years. Groups, we are not currently, groups have been a little bit of a struggle post-COVID. So we're still sort of in the planning phases for resuming some of those groups. I do know there's some talk about some parent cafe groups that are going to be coming up, I think, in 2023. So as more information becomes available, I can share that with Kimberly, who can then share it out to different partners. And also, again, like we can send resources for parent training groups, things like that, if there's centers that want some specific education, or if you are looking for, how do I get my parent information on XYZ? We do keep a list of resources of places where parents can go for additional training and support for that. But we also do support and consultation in clinical services. Our transitions group has a current protective parenting. They always have protective parenting groups going for individuals involved with child protective services. And we are in the planning phase for a parenting group for those families that are specifically involved in drug court right now, that will involve heavily the nurturing parenting and Connect the Dots curriculum. We do parent education in the form of collateral training and consultation. Even sometimes when it's not a family that one of us has seen for clinical services, we might have another person that says, hey, can you help me find a resource for this parent? So I also try to keep resources in town of what agencies are doing those parent education groups for families so that we can connect them there. The nurturing parenting curriculum is utilized pretty heavily by our CCC Community Collaboration for Children grant for in-home services. And we have parent supports through peer support specialists here at 7 counties as well that parents can get connected to. So while there are no specific trainings done, we have definitely done some parent education and support through childcare observations and through clinical services that we do at our agency level. To make referrals to 7 counties, if you want to make a referral for consultation, collaboration, or you have questions regarding community supports, and you're not necessarily trying to make you're not trying to make a referral for clinical services at 7 counties, those can be directly emailed to Lee or myself. And I always say, please add us both, because then we will both know if we have answered that question, right? Because we try to keep track of the questions that come in, and one of us will answer, and then we know that that's been replied to. So please feel free to send that to both myself and to Lee if you have questions for consultation, collaboration, or resources and referrals within the community. If you have a family who needs clinical services, they want to do individual or family therapy, or they're looking for in-home therapy or community-based supports, the quickest access to that is our access line, which is 589-1100 for ongoing referrals. All intakes that come in, when access gets a question related to a kid that is under the age of 5, they will CC me. They CC all the supervisors, but they will CC me directly on that, because they know that I'm sort of the one that tries to follow those referrals for kids birth to 5 to make sure, no matter if it comes to my site at Family Connections downtown, or if it goes other places. And then those will get sent to open access for intake. We have current open access hours at each of our outpatient sites, several days per week, and the hours are slightly different depending on what outpatient site is closest to that family. But we are currently working on getting all of those intakes in within a 10-day period, which is why we want everything to go through Access. Access gets insurance information, collects some data on what the closest site is, and gives them the information on how to get in for those family services as quickly as possible. If ever you were trying to make a referral, and this happens on every once in a while, somebody's like, hey, I made this referral. The family says they called Access. They got routed somewhere totally random. They don't know how they got to where they got to, but they definitely did not get routed to where they need to be. Feel free to send me an email, and I can track that information too and try to figure out what happened to that referral and why it got routed so oddly. It's definitely happened before that some family called for a service for their 4-year-old and somehow got to the adult site. I don't really know exactly how that happens, but every once in a while, we do get referrals that get misrouted. So if that ever happens and you have a family who's struggling, feel free to either reach out to me directly or give the family my email. I don't care about that either. They can email me and say, this is what happened and this is where I got stuck, and I will try to help them get to the correct location. Somebody had asked about play therapy and play therapy being effective for preschoolers. I am a registered play therapist. I'm also now a registered play therapist supervisor, because I feel like it is like my personal mission within 7 counties to have more play therapists working within the 7 counties region and to support more of those folks. But play therapy is definitely one of our evidence-based treatments that has a lot of research to support its use with young children, especially those impacted by trauma. There's some trauma play models. There's child parent psychotherapy, which is an evidence-based treatment model for children in trauma, filial therapy, theraplay, child parent interaction therapy. There are several different play-based models that are evidence-based for preschoolers. And so definitely play therapy, I would say, I can't say enough about the fact that I believe that play therapy is an evidence-based model that can be helpful for preschoolers. In fact, I think it is one of our more effective models for working with preschoolers, and that is what we are working on, really having most of our early childhood folks utilize play-based interventions with children and families. And last but not least, the other question that came in was, how could we improve care coordination, especially with PCPs? I will say sometimes I feel like this question is a tiny bit above my pay grade, but what I do know that we do at 7 counties is that all new clients and ongoing clients are asked to fill out a PCP release form. As long as the client agrees to have their information released and shared with their PCP, which rarely do we get clients that say they don't want that, then there's a PCP communication form that covers diagnosis and medication management or anything like that that's going on, that's completed at all intakes and annual reviews and sent over to our PCPs. In addition, if a PCP is looking for specific information, they can obtain a release and send that over, fax it to the site that's closest or where that client is being seen. And the medical record staff will get that information request over. That usually happens outside of the clinical staff, that release goes directly to our medical record staff and they send that information. And I also know that this is an issue that's been brought to the attention of our 7 counties chief medical officer and the medical team that is working to figure out, do we need additional policies for specifically psychiatry with PCPs to make sure that we get that information sent over. But as long as we have a release, we're always happy to share that information with a PCP. And usually just a client will say, hey, can you send this over to my PCP? And I'll say, sure, no problem. And I know that that's sort of what the clinical staff primarily also does. That's my contact information and sort of what I do for the agency. That's our office-based number and my extension. I am absolutely much better at answering emails than I ever am at answering phone calls. You can call me and I will call you back always, but it may or may not be as quick. I'm in and out of the office, so sometimes that just doesn't happen as quickly as an email does, but I answer emails almost all the time, except for next week when I'm on vacation, because if I do that, there's a serious possibility that my family will kick me out. So I try really hard to do it otherwise when I'm working in the office. And that is me.
Well, Darcy, thank you very much for all the great information. I have had several questions throughout the time here, so I'm going to kind of look over here on my screen where I have my notes. And one of the things I'd like everybody to kind of discuss is your language translation and how, when a child is referred that is bilingual or a non-English speaking family, or their parents are non-English speaking, what services can you provide for evaluation and support? Melissa, would you like to start?
Sure. For the KEYS program, we use InterpreTalk with certified interpreters, as well as in-person interpreters through a couple agencies that we're contracted with. So upon the initial referral, we will use InterpreTalk to contact the family, explain the program, and see if they want to move forward or not. For actual meetings and or interventions, we will attempt to get an in-person interpreter if that's the form of service that the family is receiving. We have used InterpreTalk for services as well if we cannot get an in-person interpreter.
Darcy, how about you?
If it is a Spanish speaking client, we make every effort to get them with a Spanish speaking therapist. Because we do have several at various places throughout the agency. Otherwise, we utilize interpreter services. We have a contract with a couple places in town, and so our front desk will seek out a request for an interpreter. If for some reason we cannot find an interpreter that speaks the language the client and family speak, then we've utilized the language line to do services with those families.
And Holly, I know JCPS has multiple languages that they work with. What is the process with you all?
So in the early childhood department, we have bilingual associate instructors within our program that can also help. The ladies that they're all ladies, they just happen to be ladies that are the bilingual associate instructors. They speak Arabic, Spanish, and French. But then, as the other ladies have shared, we also utilize Language Line, which has access to all types of languages to communicate with families. Teachers can use that as well to speak with their families. At all meetings, that is always going to be the case, that an interpreter is offered. But we also have ESL services for kindergarten through 12th grade through JCPS, but that they go through the assessment, an intake and assessment, and this is housed at Hazelwood. I do know it was at Newcomers over the summer. I think Hazelwood was doing some renovations, but that is for the older families. But we do translate and send materials home in the native language.
And I know there was a question about flyers for all of the folks. So I have posted the flyers that we have for First Steps and for JCPS. The flyer for Seven Counties is in development. So I do not have that right now, but as soon as I do, I can provide that out. Melissa, one of the things that I wanted to ask about is I know to be able to receive services, the delay has to affect the education of the child. So there are many things that don't qualify, such as torticollis, which is the neck tension that's just PT. That doesn't affect the education of the child. Can you talk a little bit more about that?
Yes, we are an educationally based program, so it has to be a developmental delay for us to qualify the child. Now, we can serve some kids with a medical concern if when they come through the intake process, there is a developmental concern as well. So they'll get certified or eligible for our program based on their developmental delay. And then once the therapists are in, they can address some of those other things. But for a purely medical concern that needs medical therapy, then we would refer them to another program.
There's another question for First Steps. Does First Steps recommend that early child care providers use the ASQ, Ages and Stages questionnaire, to access children before contacting you for referral?
Not necessarily. I mean, I think it's fine to use that whenever you have a question about how a kiddo's doing in their development. But if you send us that referral, we take care of all of that if the family is willing and wants the service.
In addition, if you want the family to do an ASQ, they can come through Metro United Way to do the ASQ prior to going to First Steps. If they're a little bit hesitant about First Steps, and some people are concerned because it is a state agency and people are a little bit leery of that, we can try to walk them through that process and do the ASQ and see if it's necessary. So feel free to refer them to us for the ASQ if that's something that you'd like to do. For JCPS, in terms of preschool and for the services that you provide, can families actually choose where they go?
So the enrollment process happens based off of where we were talking about that primary address that you're going to turn in, that proof of residency. They look at the seats that are available at the schools around. If a parent does not want transportation to a school and they're willing to be a parent transport, then that does open up more school options. but it is basically based off of that transportation address. And then we look at schools and we look at the classrooms that have available seats open, and that's how placement happens for students.
Okay. So what services can families seek if their child's delays do not qualify them for JCPS or First Step services? Are there other agencies? Do you have a list that can be provided?
For JCPS, if a student goes through the assessment process and they were not eligible, yes, there's information that's given at that meeting to help the families link up with maybe outside community, or as Ms. Phillips has also stated, if it's more that medical need that they're finding, they've got some information that they can provide to, give the families some initial starts of who to maybe contact. But that is, yeah, if they're uneligible, then yes. And then we also provide Head Start information for families that may not meet that income eligibility type of requirement for the 4-year-olds. So that is also something. So there's always information given.
And for all of you, when pediatricians identify concerns late during the 3rd year, perhaps, what's the best path for equipping parents to request an evaluation quickly? I know we have a delay in terms of the wait time is very long for Wise Cough and other developmental evaluations.
So for First Steps, we only serve to age 3, like I mentioned previously, and we can take referrals up to 45 days prior to their 3rd birthday. There is no way to escalate your referral in front of the other kids that have been referred, but they all are at the same expectation of having that evaluation and plan in place within 45 days. And then something else is we are the payer. First Steps is the payer of last resort. We do not make diagnoses, and we can refer a kid to be tested for autism if the parent wants that in the intake phase. But if they've already been referred by a physician, we're the payer of last resort. So we do not do an autism evaluation if they've already been referred somewhere else. So I just want to put that out there. You reminded me, and I know this question is for JCPS as well, because they're already 3.
I'm sorry, and can you repeat the first part again, Kim? Sorry.
If a child is identified late, what's the best option in getting into services quickly?
And they're identified from an outside source, not JCPS.
And so when a pediatrician is identified developmental concerns late during the 3rd year, what's the best path? And is that just coming through the ECE and doing evaluation there?
Yeah, so you're going to use that screening link, or you can also fill out that multidisciplinary referral link. That will take you right in there. Say that the physician gave information and said, I'm just pulling it out there, there's a global developmental delay, is what the physician might be saying. The parent will put that information in the referral process, and then in that referral, and then what happens is once that's complete, someone will contact you to set up that first initial meeting to talk about the concerns. Is there any outside diagnosis that we should be aware of? And then we work in that meeting with the families to gain consent. Maybe they want to give us consent to talk to that provider that gave, or the physician that gave the diagnosis. There's paperwork that JCPS can give to the family that they will sign that will give us that right to speak to that outside service physician to gain more information and any necessary paperwork to complete and make it a very well-rounded referral so that we know what we need to assess the child on moving forward. But it is that process. And like Ms. Phillips said, there is that, there's no way to expedite it. But sometimes with that outside diagnosis, parents have paperwork, and that's very, very helpful when completing the referral. So all of that's wonderful information to provide when you're contacting JCPS.
Okay. And are there anything that automatically qualifies children for services?
within the early childhood department, if they already have, they're 3 and they're coming in and they've gone through that transition meeting with First Steps, and that maybe they were receiving services with First Steps and they came through with JCPS, and they're found eligible within JCPS as well, then that is, their services are provided based off of their educational plan that's made of the areas within eligibility.
So for Kentucky Early Intervention System, we do, oh goodness, what was the question again, Kim?
Automatically qualified.
Oh, yes. Sorry, I was thinking of 2 different things there, but we do have a list of established risk, which does qualify a kid automatically. And that list we look at. So when we get the well child check and get the medical information, or sometimes we get kiddos referred from the NICU with all that about, they can do the evaluation there. But there is a list of diagnoses. It's quite long, and you probably, unless you're a physician on here, haven't heard of half of them. So one of the things on there that everyone's aware of is Down syndrome. But there's a whole list that would qualify a child. Now, if they're not showing a developmental delay at that time, they are still qualified for our services. So we can offer the family service coordination, even if the child doesn't need interventions at that time.
And Darcy, do you have anything to add?
I mean, like, as far as automatically qualify, I don't know that there's anything that would automatically qualify any other than, like, they can call, and if they want services, then they're going to give them information on how to get into services. So I don't know that there's anything specific that would not qualify somebody for 7 counties support services. There are times when families come in, especially kids under the age of 3, when they call and what they're really asking for is something that more like speech or OT or things like that, in which case then we're probably going to refer them over to the Kentucky Early Intervention Services or public preschool or something. If it's not a mental health related service, then we would refer them to the appropriate location for that.
So the next question in the chat is, what's the connection, if any, between the IFSP from Keys and IEP from JCPS? Does the ISFP automatically translate into the IEP? And I know we touched on this a little bit, but if we can get a little bit more information about that transition process.
So that is actually what I was thinking about when I lost my train of thought a minute ago about established risk, was that a lot of our families do think that if they qualify for First Steps, that they automatically qualify for JCPS or whatever their county's public school is. And that's not exactly the case. JCPS or whatever public school system does do their own assessment. It does, being part of First Steps and qualifying for First Steps does put them on a different track of being assessed in a faster timeline. So I just wanted to point that out, because a lot of the community feels like they got to get them in at that last minute with First Steps, because now we want to go to school and that's how we're going to get there.
All right. Please make sure if you have any additional questions that you do post them in the chat. Do any of you do workshops at nonprofit organizations outside JCPS 7 counties to educate on nurturing parenting, productive parenting, or how to recognize early signs of developmental delays?
We do not yet, but I do believe that Department of Public Health, who governs all the points of entries, is going to be working on that. We're meeting to discuss that. So KIPTA point of entry will be more information to come later. Maybe I'll send it to Kimberly as soon as we get our marching orders on what that looks like, so that she can send it out to everyone.
And I do not, but I can also go back to the office and check to see if there's any community-based trainings that can help touch on some of those things. I think those are wonderful topics that would really be amazing to deliver on. So Kim, I will get you that information too. I'll ask.
Okay, great. And if you guys have any other needs or wants on ideas and things and topics that you would like to see presented in this kind of a format, please don't hesitate to put that on the evaluation form. I will put the evaluation form out in a minute, but we are looking to do more of these community conversations. So please make sure you indicate some of the things you'd like to see. One of the last questions I have is, in light of the close connection between school success and health, how can we improve the communication between school and healthcare providers?
My end, from a JCPS standpoint and a past teacher, anytime that you're visiting or doing a well visit for your child, or maybe you had to take your child, they've been under the weather, so you're talking to the doctor more. Anything that is pertinent to be relayed back to the teacher to help. Just sometimes even if a child's had a couple bad ear infections back to back, the teacher knowing that can kind of be cognizant of you're a little irritable, you have that ear pain, but definitely just keeping that communication that's shared from the physician to the relaying anything to the teacher of record. But also, like I shared earlier, there is a form that JCPS has that will allow the parent to sign and give that service provider the right to talk to a JCPS representative for any kind of medical questions or things like that.
Right. I think that wraps up all of the questions that have been in the chat. I am putting everyone's contact information in the chat, except apparently mine. So let me put my email in there. So feel free to contact me with any questions. Keep your eyes out for that follow-up email with all of the information and notes and all of the documents that are available. And we do have an evaluation that we'd love to get your feedback on, just to see if this is something that has been useful for you and whether or not it's something you want to continue with, and what organizations you'd like to see more information on, or if there's more detail from the presenters today that you would need, feel free to put that on the evaluation as well. I appreciate everybody being here today, and my panelists. I really appreciate everything you do for our community and for all of the children in our community. So this will conclude the webinar. I will stick around for a few minutes. If anyone has additional questions or would like additional information, please let me know. So everybody have a great rest of the week and enjoy this beautiful weather while it lasts, and we don't end up having to put our snow boots on, as well as our shorts, the way Kentucky goes.
That is right. Thank you for having us.
Thank you, Kim.
Thank you.